From April the 6th, employee national insurance will be cut by another 2p from 10% to 8%. And self-employed national insurance will be cut from 8% to 6%. It means an additional £450 a year for the average employee, or £350 for someone self-employed. When combined with the autumn reductions, it means 27 million employees will get an average tax cut of £900 a year. 2 million self-employed will get a tax cut averaging £650. The government will abolish the current tax system for non-DOMs, get rid of the outdated concept of domicile. We will replace the non-DOM regime with a modern, simpler and fairer residency-based system. From April 25, new arrivals to the UK will not be required to pay any tax on foreign income and gains for their first 4 years of UK residency, a more generous regime than at present and one of the most attractive offers in Europe. But after 4 years, those who continue to live in the UK will pay the same tax as other UK residents. Recognising the contribution of many of these individuals to our economy, we will put in place transitional arrangements for those benefiting from the current regime. That will include a 2-year period in which individuals will be encouraged to bring wealth earned overseas to the UK, where it can be spent and invested here, a measure that will attract onshore an additional £15 billion of foreign income and generate more than £1 billion of extra tax. Overall, abolishing non-DOM status will raise £2.7 billion a year by the end of the forecast period. To discourage non-smokers from taking up vaping, we're today confirming the introduction of an excise duty on vaping products from October 26 and publishing a consultation on its design. Because vapes can also play a positive role in helping people quit smoking, we'll introduce a one-off increase in tobacco duty at the same time to maintain the financial incentive to choose vaping over smoking. I'll make a one-off adjustment to rates of air passenger duty on non-economy flights only to account for high inflation in recent years, and I'll provide HMRC with the resources they need to ensure everyone pays the tax they owe, leading to an increase in revenue collected of over £4.5 billion across the forecast period. Next, I turn to property taxation. In recent months, following tenacious representation from the honourable members for St Austell and Newquay, North Devon, cities of London and Westminster, Torbay and Truro and Falmouth, I have been looking closely at our furnished holiday lettings tax regime. I am concerned that this tax regime is creating a distortion, meaning there are not enough properties available for long-term rental by local people. So to make the tax system work better for local communities, I'm going to abolish the furnished holiday lettings regime. Today I am announcing a landmark public sector productivity plan that restarts public service reform and changes the Treasury's traditional approach to public spending. And I start with our biggest and most important public service, the NHS. One of my greatest privileges was to be Health Secretary. Thanks to the NHS, I have 3 gorgeous children, the oldest of whom has been patiently listening in the gallery. The NHS is rightly the biggest reason most of us are proud to be British, but the systems that support its staff are often antiquated. Doctors, nurses and ward staff spend hours every day filling out forms. When patients don't show up, or one member of a team is ill, operating theatres are left empty despite long waiting lists. Now, when we published the NHS long-term workforce plan, I asked the NHS to put together a plan to transform its efficiency and productivity. I wanted better care for patients, more job satisfaction for staff, and better value for taxpayers. Making changes on the scale we need is not cheap. The investment needed to modernise NHS IT systems so they're as good as the best in the world costs £3.4 billion. but it helps unlock £35 billion of savings, 10 times that amount. So in today's budget for long-term growth, I have decided to fund the NHS productivity plan in full. Yeah. With that new investment, we will slash the 13 million hours lost by doctors and nurses every year to outdated IT systems. We will cut down and potentially halve form filling by doctors using AI. We will digitise operating theatre processes, allowing the same number of consultants to do an extra 200,000 operations a year. We'll fund improvements to help doctors read MRI and CT scans more accurately and quickly, speeding up results for 130,000 patients every year and saving thousands of lives, something I know would have delighted my brother Charlie, who I recently lost to cancer. We'll improve the NHS app so it can be used to confirm and modify all appointments, reducing up to half 500,000 missed appointments annually and improving patient choice. We'll set up a new NHS staff app to make it easier to roster electronically and end the use of expensive off-framework agencies. And as a result of this funding, all hospitals will use electronic patient records, making the NHS the largest digitally integrated healthcare system in the world. Today's announcement doubles the amount the NHS is investing on digital transformation over 3 years. And on top of this longer-term transformation, we'll also help the NHS meet pressures in the coming year with an additional £2.5 billion.